Appendicitis is a painful inflammation of the appendix, a small finger-shaped pouch that extends from the colon. The appendix is located in the lower right abdomen. While the exact function of the appendix remains a mystery, it is thought to play a role in the immune system. Appendicitis occurs when the appendix becomes blocked, often by fecal matter, foreign objects, or in rare cases, tumors. This blockage leads to inflammation, swelling, and pain. If left untreated, appendicitis can quickly become a life-threatening condition. The appendix can rupture, spilling infectious material into the abdominal cavity. This can lead to peritonitis, a serious infection of the abdominal lining. Fortunately, appendicitis is a common condition, and with prompt medical attention, is usually treatable. Early diagnosis and treatment are crucial to prevent complications. The primary cause of appendicitis is a blockage within the appendix. This blockage can occur due to various factors, often involving a combination of elements. One of the most common culprits is fecal matter. When hardened stool becomes lodged in the appendix's narrow opening, it creates an obstruction. This obstruction prevents the appendix from draining properly, leading to inflammation. In addition to fecal matter, foreign objects can also lead to appendicitis. These objects can include seeds, small pieces of food, or even parasites. While less common, the growth of tumors in the appendix or nearby areas can also compress the appendix, causing blockage. It's important to note that while we understand the mechanisms behind appendicitis, it's not always possible to pinpoint the exact cause in every case. Sometimes the blockage occurs without a readily identifiable reason. Recognizing the symptoms of appendicitis is crucial for seeking timely medical attention. The most common symptom is a dull pain that begins near the belly button and gradually shifts to the lower right abdomen. This pain typically worsens over time and can become quite severe. Loss of appetite, nausea, and vomiting are also frequently associated with appendicitis. These digestive symptoms often accompany the abdominal pain, making it difficult to eat or keep food down. As the inflammation progresses, other symptoms may develop, including fever, chills, diarrhea, or constipation. It's important to note that the location and intensity of pain can vary depending on the individual and the position of the appendix. Diagnosing appendicitis. A step-by-step approach. Diagnosing appendicitis involves a combination of medical history review, physical examination, and diagnostic tests. Your doctor will begin by asking about your symptoms, including when they started and how they have progressed. During the physical exam, your doctor will gently press on your abdomen to assess for tenderness, particularly in the lower right quadrant. They may also check for rebound tenderness, which is pain that worsens when pressure is released. To confirm the diagnosis, your doctor may order several tests. A blood test can reveal signs of infection, such as an elevated white blood cell count. Urine tests can help rule out other conditions, like a urinary tract infection, that can mimic appendicitis symptoms. Imaging tests such as an ultrasound or CT scan provide detailed pictures of the appendix and surrounding organs, allowing your doctor to visualize any inflammation or blockage. In some cases, a laparoscopy, a minimally invasive surgical procedure, may be recommended to visualize the appendix directly. Treatment options for appendicitis. The standard treatment for appendicitis is surgical removal of the appendix, a procedure known as an appendectomy. Appendectomy is a relatively safe and common surgery that can be performed laparoscopically or through a traditional open incision. Laparoscopic appendectomy involves making several small incisions in the abdomen and inserting a laparoscope, a thin telescope-like instrument with a camera. The surgeon uses the camera to guide the removal of the appendix, minimizing scarring and recovery time. Open appendectomy, on the other hand, involves making a larger incision in the lower right abdomen to access the appendix directly. This approach may be necessary in cases of a ruptured appendix or if laparoscopic surgery is not feasible. In some cases, if the appendicitis is caught early and the appendix has not ruptured, treatment with antibiotics alone may be an option. However, this approach is less common and requires close monitoring. The importance of early detection and treatment. Early detection and treatment of appendicitis are crucial for preventing serious complications. If left untreated, appendicitis can lead to a ruptured appendix, a life-threatening condition. When the appendix ruptures, it releases infectious material into the abdominal cavity, causing peritonitis, a serious infection of the abdominal lining. Peritonitis can lead to sepsis, a widespread inflammatory response that can damage organs and be fatal. Prompt medical attention significantly reduces the risk of complications. By recognizing the symptoms of appendicitis and seeking immediate care, you increase the likelihood of a successful outcome. Living a healthy life after appendicitis. After an appendectomy, most people recover quickly and fully. You may need to stay in the hospital for a day or two after surgery. During this time, you will be given pain medication and fluids intravenously. Once you are discharged from the hospital, it's important to follow your doctor's instructions for recovery. This may include gradually increasing your activity level, avoiding strenuous activities, and eating a healthy diet. You will also need to keep the surgical incision clean and dry to prevent infection. Your doctor will provide specific instructions on wound care. In most cases, you can return to your normal activities within a few weeks after surgery. However, it's important to listen to your body and avoid overexertion. With proper care and attention, you can expect a full recovery from appendicitis.